Okay. Do they know once I stand up?
She's gonna start exactly at 6 o'clock.
Okay.
She's probably watching. So if you're
Okay.
right there, look at
You may be seated. Good evening. Welcome to Florida Southern College's White Coat Ceremony. My name is Tim Burns, and I'm an instructor in the undergraduate nursing program. The faculty and staff of the Ann Blanton Edwards School of Nursing and Health Sciences are pleased that you could share this special event with our second-year nursing students. Tonight marks the beginning of the clinical practice portion of the nursing program. This ceremony, established by the Gold Foundation, first occurred in 1993 at Columbia University. It was created for medical students to symbolize the beginning of their careers. In 2014, recognizing the vital role nurses play in the healthcare team, the Gold Foundation partnered with the American Association of Colleges of Nursing to adopt a white coat ceremony for nursing. Today, over 360 schools of nursing participate, and that number continues to grow. The white coat ceremony serves to welcome nursing students to clinical practice and elevate the value of humanism as the core of healthcare. It provides a powerful emphasis on compassion in combination with scientific excellence. The white coat is seen as a symbol of authority and professionalism. It symbolizes the nursing students' vow to provide comprehensive and compassionate, client-centered care. The most important element of this ceremony is a compassionate care pledge the students will take to acknowledge their central obligation of caring for a client. The students will be asked to recite this pledge later. Again, welcome, and we hope you enjoy the ceremony. I would now like to introduce Reverend Tim Wright, who will provide us with our invocation.
Will you join me in prayer? Holy and loving God, we give thanks for who you are and all that you have done and continue to do in our lives. Because you are the great physician, we lift up to your care those whom we trust to care for us. As we celebrate those who receive their white coats this evening, we pray that they will bring comfort where there is pain, that they will bring courage where there is fear, that they will bring strength where there is weakness. Guide them throughout this journey so that they might be used in powerful ways to provide hope and healing. All this we ask, trusting in your amazing grace. Amen.
Good evening. I'm very pleased to introduce our guest speaker for this event. Dr. Michelle Fox has over 17 years of nursing experience, including pediatric intensive care registered nurse, nurse faculty, certified diabetes educator, and professional development specialist. In addition to her PhD, she has a graduate certificate in program evaluation and is certified in nursing professional development. She serves on the Lakeland Regional Health Nurse Practice Council and the advisory councils of Polk County's high school medical academies. Dr. Michelle Fox is currently the Nursing Student and Residency Program Manager at Lakeland Regional Hospital. Her focus is on elevating nursing practice through nursing academic practice partnerships and nurse residency. During her time at Lakeland Regional Health, she has also led the orientation for nursing and nurse support roles, developed nursing curriculum to open the Banish Institute for Inpatient Rehabilitation, and co-led curriculum development of 9 departments to open the Carol B. Jenkins Barnett Pavilion for Women and Children. Dr. Fox is passionate about advancing the profession of nursing and guiding new nurses successfully through the transition to practice using adult learning concepts to build their skill, knowledge, and confidence. She loves to inspire and share her passion for nursing with high school and college students who are interested in a healthcare career. Please help me to welcome Dr. Fox.
Good evening. It's so wonderful to see your beautiful red and gray scrubs and those white jackets that you're about to receive. Beginning clinicals is a first step into the real-world practice of nursing. You are going to have many challenges throughout the next few months, but you are going to overcome them with amazing perseverance and resiliency. This is the chance that you've been waiting for, to take all of your nursing skill and knowledge, and now you get to apply it at the bedside. The patients that you're going to be caring for are going to be at their most vulnerable. They are going to look to you to care for them compassionately, using empathy and kindness. Throughout your clinical experiences, you are going to see many sights, sounds, and yes, even smells, throughout which may surprise you, will give you new insights into the world of nursing, and give you an amazing experience as you get ready to graduate. The field of nursing offers many wonderful opportunities. You are going to see lots of those opportunities during your clinical experiences. You'll have opportunities to see medical patients, surgical patients, pediatric patients, adults with special needs. You'll have the opportunity to care for some of the community's most vulnerable, some of our elderly patients. Now, I know in just a very short time, you guys are going to begin your clinicals in the skilled nursing facilities and in some of our long-term care facilities. How many of you are feeling a little nervous? It's okay to be honest. If you weren't nervous, I would question whether or not you knew what you were getting yourself into. It's okay to be nervous. Are you excited? Absolutely. Nervous and excited describes pretty much, and I think I can speak for faculty, everyone's first nursing clinical experiences. I think we were all very much a mix of excitement, nervousness, fear of the unknown, and probably a little bit scared to enter that first patient's room. Know that these feelings are normal. Know that you're going to overcome them, and know that when you step across that threshold and you enter the patient's world, that you are now becoming a part of that patient's life story. You may not remember your patients. They may not remember your name, but they will remember you for the rest of their lives. As a nursing student, you get the very special honor of having extra time with your patients that once you graduate as a nurse, you may find harder to achieve. You have the opportunity to build relationships with your patients, to get to know them as more than just a diagnosis and a disease. They are a human being. Learn about their life, ask them questions, get to know them. When you truly get to know your patients and they feel cared for, you'll be amazed at the different outcomes that you receive. These patients all have stories, and you are now a part of that story. You will become a permanent part of that patient's story. So use your great power wisely. As you continue throughout your nursing career, you're going to have times when you feel overwhelmed. You've probably already experienced that a little bit in nursing school. It doesn't take much for all of the textbooks and the tests and everything to quickly overwhelm you. You'll have similar circumstances when you're a nurse. Don't give up, persevere, and be resilient. You are part of an elite profession that is probably one of the most rewarding professions, that has so many wonderful opportunities and will give you a sense of fulfillment like no other profession that is out there. If you have questions, when you get scared, when you have concerns, turn to each other for support, turn to your faculty for support. They're going to be here to guide you through these times. This past 18 months, almost 2 years now, it feels like, of this pandemic have changed the world of nursing as we know it. But it is not the first time that nursing has changed. This is not the first pandemic nursing has faced. We will continue to be resilient. We will continue to move forward, and we will continue to grow in the science and evidence-based practice to give our patients the best outcomes possible. All of that science, all of that great nursing care and skill is so vitally important. But the most important thing you can do for your patients is to care for them. Truly care for them. Meet them where they are. Oftentimes, it's not going to be pretty. They're not at Disney World. They're not usually happy to be where they are, but they need to be where they are, and you can turn that around for them. Be kind to them. Listen to them. Be a sounding board for them if need be, and be an advocate for them. If you see something that you feel is not right, or you're worried or question something, speak up. Let your instructors know. Your instructors can help you communicate with your nurses. Be that advocate for your patients that you're going to continue to be throughout all of your nursing career. And remember that even when patients are vulnerable and they often can be angry or lash out, remember that it's never about you. It's always about things that they can't control. There are so many things they can't control. Be that kind, compassionate ear. Continue to listen to them, and you'll be surprised at how they can turn around for you. I am so very, very thankful that we continue to have generations of nursing students who hear the call and the passion for nursing. Continue that passion. Continue it throughout your entire career. And when you graduate and become an RN, don't stop there. There are so many amazing, wonderful opportunities in the field of nursing. Continue to grow professionally. There are certifications out there, leadership. We need strong nurse leaders, and we need, most importantly, kind, compassionate nurse leaders. So as you embark on this next step of your journey, I want you to take a deep breath, because you're going to have a little bit of nerves, and jump in both feet wholeheartedly. When you're tempted to hover by the doorway and just watch and observe, I want you to be bold, take a deep breath, and go right in that room. Clinicals are the opportune time for doing. This is where you get to take all of that wonderful skill and practice and actually apply it to real-world nursing. I know it's going to feel a little strange. You've been doing a lot of simulation and practice, probably even with each other, and so doing it on a patient might feel a little different. Don't be afraid of that. Push forward. This is your chance to learn, your chance to grow. See things, pay attention to things, learn from the experiences that you have, ask questions, be bold, and you will be graduating in no time. Time will fly. It will feel, those shifts sometimes can feel like very, very long shifts, but time will fly, and the experiences that you gain and the people that you will meet will stick with you forever. I will never forget my very first nursing home patient that I was asked to help her get dressed. And I felt very inadequate during that time frame because I just was like something so simple, and yet I was scared and nervous. And looking back now, I see that during that time, I got a chance to build a relationship with that patient. I talked to her, got to know her, and even in the basic tasks, it wasn't really about those tasks that I was so worried about. It was about that communication, and to where she was able to smile and be so grateful and thankful that we took the time to spend with them. So in conclusion, you have chosen an amazing career. I wish you the best of luck, and I look forward to seeing you very soon at the Hospital for Clinicals next semester. Thank you.
Okay. Hi, sophomores. My name is Brittany Behrens. I'm one of the instructors for this amazing sophomore class. We're ready to move on to distributing the white coats. Dr. Linda Foley will be placing those coats. Okay. Aliamara Alvarado Saucedo. Jordan Bell. Emma Brown. Abigail Burden. Elizabeth Callahan. Mary Angeli Carbajal. Catherine Childers. Katie Craig. Olivia DiAugustino. Ava Dahan. Casey Dimmick. Maya Evancho. Jayla Fairley. Lindsay Flynn. Helena Fuentes. Riley Haig. Lauren Hamner. Rachel Horn. Lauren Hughes. Abigail Jeter. Gabriella Kraus. Zoe Kunkel. Marissa Mahood. Lauren Mark. Lillian McSpadden. Tyler Milkey. Alyssa Moore. Mackenzie Morris. Caitlin No. Emily Peck. Isabel Perrine. Brianna Reinish. Michaela Richardson. Samantha Rodriguez. Ava Schellebarger. Taylor Snoots. Grace Spader. Elizabeth Sund. Ivy Thrasher. Ruby Troutman. Casey Weatherford. Noah Yao. Let's give one more big round of applause for our nursing students. Now I'm going to ask the nursing students to stand at their seats, and we are all together going to recite the Nursing Students Compassionate Care Pledge. This can be found on the back of your program. Recite it along with me. As a nurse dedicated to providing the highest quality care and services, I solemnly pledge that I will consider the welfare of humanity and relief of suffering my primary concerns, act in a compassionate and trustworthy manner in all aspects of my care, apply my knowledge, experience, and skills to the best of my ability to assure optimal outcomes for my patients, exercise sound professional judgment while abiding by legal and ethical requirements, accept the lifelong obligation to improve my professional knowledge and competence, promote, advocate for, and strive to protect the health, safety, and rights of the patient. With this pledge, I accept the duties and responsibilities that embody the nursing profession. You may be seated. I am now pleased to introduce Marissa Smith as our senior student reflection.
Good evening. Welcome, faculty, family, and future nurses. My name is Marissa Smith, and I'm a senior nursing major here at Florida Southern. Tonight marks a monumental occasion that none of you and your families will soon forget. You will take all of the knowledge, hard work that you have put into class, clinicals, to becoming a good nurse. Clinicals, congratulations. You have made it to the point that I am sure most of you have been itching to get to since you even started the program. I have been in your shoes, and let me tell you, it's okay. You can be nervous, but know that you are ready. To put your mind at ease and aid you in your clinical experience, let me provide you with some helpful tips to take forward. 1. Be on time. In fact, just leave 10 minutes early than whatever you thought you should leave, because you'll be late. Trust from experience, it's dark and you'll get lost at least once. 2, eat breakfast. Even if you're not hungry, just nibble on something, because by lunch, you'll be starving. Also, speaking from experience, for some bizarre reason, the smell of C. diff or burning skin from a cauterizing tool in the OR is a lot less stomach-turning if there's something in there. 3, ask questions. Being inquisitive will make you a better nurse. If you do not understand something, ask. Sometimes stuff in real life looks a lot different than in the books. 4, get your hands dirty. Well, not really. Please wear gloves and proper PPE. What I mean is, do not be afraid to jump in. You don't want to be standing around in the halls. You need to maximize your day. Do bed changes with a PCT. Follow a nurse as she's giving meds and ask what each one is for. Do vitals for the whole hall, because guess what? Even if you've done 1 million vitals, it'll only make you faster and more efficient. Clinicals is what you make it, so make it a good one. Lastly, I cannot stress enough, please know that Rome was indeed not built in a day. You cannot expect to go to your first clinical and do every skill that you have ever learned. Some days might just be helping feed patients and giving bed baths, and that's okay. Just hang in there. You can't expect to run off and do all the more daunting tasks right out of the gate. You will get to do them. You will reach those moments. If you follow these little guidelines, you will rock clinical. I remember that there was a time in the program that I had to ask myself when it was that I would know that I was built for this. I kept asking myself, can I handle all the knowledge, the hardships, the burnouts, the meds? And do you know what the ironic part is? I had my eureka moment, not while I was suctioning a tracheostomy tube. I had my eureka moment not while I was administering a tube feeding, and not while I was doing a wound dressing change. I had my epiphany moment on a Monday night around 11 p.m. at Pediatrics Clinical, holding a baby in the NICU. That's it. That's all it was. As I sat in a recliner and sang to the neonatal abstinence infant whose parents had abandoned him, I knew that this was it. This moment was why I was doing all of what I was doing. The late night studying, the early morning clinicals, the papers, it all surmounted to a single moment. It didn't matter what meds I knew. It didn't matter what skills I could whip out and perform. What mattered was the care. At the basis of it all, that's what we do as nurses. We care. As I held that helpless little withdrawing child in my arms, nothing else mattered but them. That was the moment that changed my life an entire outlook on nursing. You will have your moment. It will not always be the same. Trust when I say you will know when it happens. I know my eureka moments of holding babies in the NICU, talking to coma patients in the ICU about chicken tenders, and watching someone learn to walk again after a car accident seems like I wasn't doing anything truly nursing specific at all. On the contrary, it's often the little things, the true caring, that gets overlooked. Remember, it isn't always about the specialties you bring to the table, but the presence you can have in someone's life. They'll remember your presence, so make it a beautiful one. So as this pep talk comes to a close, I guess through it all, I mean to say good luck. You might not feel prepared in all aspects, but you will be. Everyone here, the faculty, your family, your friends, they want to see you succeed. Lean on them through all of this and know that they are a resource there to aid you. You are ready for whatever tomorrow brings. I can see that in you, and you should too. I hope you leave feeling like you can conquer the world. And I hope you leave feeling like you can move mountains, because guess what? You can. I look out to the crowd and I see the future nurses of the world. You will save and alter more lives than you could ever know. The impact you have is everlasting. Never feel small in the world because the purpose you provide is so vast. Thank you.
Good evening. My name is Philip Fiorello, Assistant Professor of Nursing in the BSN program. I have the distinct privilege of being able to spend 3 days a week with these amazing students. It was very nice to be able to see the smiles underneath the masks for a change. As this white coat ceremony comes to a close, I would like to thank our two speakers, Dr. Michelle Fox and Ms. Marissa Smith, for sharing their words of wisdom for our sophomore students. I would also like to thank all the faculty and staff for their hard work in preparing the students to enter the clinical portion of their program, as well as coordinating tonight's ceremony. I would also like to thank the family and friends of our students for coming this evening to share this special milestone with them. Your support of our students is crucial for their success. I would also like to thank Dr. Dean Comer for her continuous support of the BSN program, the faculty, and the students. Finally, I would like to wish the students the best of luck as they move forward. This is an exciting part of your nursing school journey, and we're all here to support and celebrate you. The ceremony is now complete, and we wish you safe travels home.